What are Medicaid eligibility requirements for disabled adults? Imagine having the support you need to stay healthy and independent while raising a family. That's what Medicaid can do for disabled adults. But how do you qualify? Let's break it down. First, you need to be considered disabled according to the Social Security Administration. This means having a physical or mental impairment that limits your ability to work significantly. The impairment must last at least 12 months or be expected to result in death. Disabilities from birth or acquired later through illness, injury, or trauma all count. Next, your income and assets matter. Most states follow the federal standards, which in 2025 set the income limit at about $967 per month for an individual. Assets are usually limited to around $2,000. Assets include things like cash, bank accounts, and property, but some items like your primary home and a vehicle may not count. States may have additional rules. For example, if you need long-term care, you might have to undergo a level of care assessment. This checks how well you can do daily activities like bathing, dressing, eating, toileting, transferring, and moving around. Some states also look at instrumental activities of daily living, such as cooking, cleaning, and managing medications. Most disabled adults qualify for Medicaid if they receive Supplemental Security Income benefits. When you get SSI, Medicaid coverage usually starts automatically. You can also qualify through programs like Medicare Savings programs, which help with Medicare costs but may not cover everything Medicaid does. If your income is slightly above the limit, some states allow a spenddown. This means deducting your medical bills from your income to meet eligibility. For example, if you have high medical expenses, they can lower your countable income, helping you qualify. Understanding these rules is especially important for disabled parents or those parenting with disabilities. Medicaid can cover essential health services, personal care, and long-term supports. These benefits help parents care for their children and stay independent. To apply, most people go through the SSI pathway, which simplifies the process. Keep detailed records of your income, assets, and medical expenses. If you need long-term support, ask for a level of care assessment. Remember, Medicaid can also provide home and community-based services, helping you stay in your home while receiving the support you need. In short, qualifying for Medicaid as a disabled adult involves proving your disability, staying within income and asset limits, and sometimes passing a functional assessment. For parents with disabilities, Medicaid offers vital health and support services that help create a more inclusive family life.